We have two big computers here. Why don't you just use this one?
Because you need to. I
I'll
got
work
it.
on this later.
Hold on. Is this even?
The answer is A. Good job. So we want to decrease the risk of strangulation because yes, they can strangle themselves with their bibs. Okay, a nurse is instructing a group of parents and guardians about child development. Which of the following recommendations should the nurse make to promote the developmental task of industry? Okay, what is industry? What developmental age is that?
Oh, that's like
Isn't that elementary school?
Yeah, school age, like six,
Like
eight.
six.
Right there, it's
like
telling
early
you
school
guys,
age.
it's telling you guys in the question. But if you guys want to review that, we can review it. Do you guys want to go over the school, the industry, or you want to just do the question first?
Just the question first.
Okay. So have an after school snack ready for the child each day. So industry versus inferiority. What is that developmental task looking at?
You're promoting independence for them, I think.
Mhm.
Like
You're
small,
promoting what? I'm sorry?
like independence, or like for them to be able to do stuff for themselves.
Yeah, kind of that way. So we want to have them in the after school snack ready for them for the after. Assign the child several small chores. Talk with the child about what the future goal as an adult, or talk openly about the family value system.
B, my lord, B.
B.
So we want to have them chores to do after school?
Yes.
Yeah, like so that they could like do little objectives for themselves.
Okay. The answer is B. So let's go over some of the incorrect answers. Providing consistent care that meets the physical promotes trust. So that is what stage is trust. Trust versus mistrust.
That's like the very beginning. That's little infant.
That's it when they're infant. Okay. And discussing career choices and plans for adulthood is more like developmental task of identity. So it's more with an adolescent. We're not going to discuss your life, your life plans with a little kid. And then talking about the family value system is again an adolescent. And what stage is adolescence again? What do we say it is? Piaget and Erickson's. Do you guys remember?
Wait, what was the question again?
What developmental stage is Piaget and Erickson's?
What are you looking
for? Like, wait, for adolescent?
Yeah, for adolescent.
For adolescents, well, adolescence is an identity thing, so that's a Erickson.
Yeah, but what is the adolescent phase?
Adolescence, identity versus role confusion, but Piaget's I forgot.
Does anybody remember? I'm gonna open up. Do I need to open up the PowerPoint or the book? So Piaget, hold on. I'm gonna go back. So Piaget is formal operations. So what is formal operations?
The ability to do operations formally and in an order.
So they're basically learning their own stuff on their own. They're basically questioning things like values, family values, things that they've been taught when they're little. And then Erickson is identity versus role confusion. So they're trying to figure out who they are, what is their identity, and not confuse themselves in the roles of whatever this of themselves as individuals. All right, let's move on. A nurse in a pediatric unit is planning care for a preschooler who will be having a surgical procedure in the morning. The child has been crying. The nurse starts engaging the child in therapeutic play. I can't, can somebody mute in the back, please? I'm sorry, I can't. Okay. The nurse should add engaging the child in therapeutic play to the care plan to offer which of the following benefits. So this child is going to have surgery and the child is anxious, basically. What do we want to do so the child can decrease their anxiety?
B. Let them play with the medical equipment.
B.
What about C?
I mean, you already know how the child's feeling.
Okay. How about D?
The parents have been at their bedside. Like that's already going on. They're already engaging with their child being there.
So it's B.
The unfamiliar.
So remember, this is family-centered care. We want to decrease that stress. Who else can we call if we want to decrease that stress that can help us out?
child
child
life.
Child life specialist.
Child life specialist, good.
Well,
Okay.
I'm sorry. What was the answer on the last one? No,
Which one?
no, the one after. Yeah, it was B, right?
Yeah.
B. Okay, thank
So
you.
we want them to touch this other things, if it's a stethoscope, whatever we have available, so they can see what they're going to be, what the, decrease their anxiety. Okay, so we are assessing the fine and gross motor skills of a toddler. So what should we expect for a 3-year-old? Can they move backwards, moving heel
Probably-
to toe?
I'm say B, standing on one foot for several seconds.
How about using scissors?
No.
No.
And don't read into this question what kind of scissors. Just
You don't
Huh?
really have, like the coordination for that yet.
okay. What about walking backwards? I always think of this like they're kind of
No.
like walking kind of.
They're gonna fall on their butt.
Printing letters with a pencil? No, they're too little. All right, so A, everybody, so somebody said A? Okay, somebody's saying A. All right, so
B.
everybody says, some people say A, some people say B.
B.
The answer is B, standing on the foot. So walking backwards, like moonwalking, I kind of think it is a 5-year-old. Using scissors is a 4-year-old, and then printing letters again is a 5-year-old, like we talked in the beginning. So a nurse is assessing an infant who was born at 32-week gestation and is 8 months old. Which of the following developmental stages should the nurse expect the infant to demonstrate? So this was kind of like almost a preemie baby. He was born at 32 weeks. So you could say it's almost like a preemie baby.
So is this considered like an adjusted age?
Yeah,
Okay.
almost like an adjusted age.
So
he should be at 6 months. Some people are saying 6 months.
you have to
Ever,
Anybody else?
you have
ever
to subtract
6 or
8
8?
yeah. Well, you have to subtract 8 weeks, which is 2 months, so 6 months C.
So 2 months is a little too young. I mean, even though they were born early, they're still. How about 4 months? No 4 months takers? Okay, let's look at it. The answer is 6 months. The rationale is because the infant was born at 8 weeks premature, the nurse used the data to determine that the infant setback is 6 months, and then they should be at developmental milestone of 6 months. Okay.
So to answer that question, like you always tell us, don't look too much into it.
Yeah.
Would it have been too much to say like, oh, but they can catch up developmentally? So
Yeah. No. Don't do that. Don't do that. Because this is still considered an 8-month-old, 8-week preemie baby. So they're always going to be a little behind. 2 months is too much. And don't start thinking, oh, well, what if he developed, this and that? No, don't. He's usually about 2 months behind of their age.
Hello?
Yeah. That's usually the rule. So yeah, don't think, oh, well, he can catch up. If you do that, you're just reading too much into it.
Like how they were saying.
Okay, 4-year-old preschooler, what should he be able to actually? This is almost the same question. Should he be roller skating, jumping ropes, skipping, or hopping on one foot? This is kind of similar.
I mean, some 4-year-olds can skip,
I think A.
but yeah.
Hopping on one foot for a 4-year-old. Okay, a nurse is teaching a group of parents about growth and development. Then the parent asks, why does my child's abdomen stick out? So I see that a lot of kids, especially toddlers, have the little sticking gut. What should we provide? You should give your child a stool softener daily, so that you're trying to say they're backed up. Toddlers gain weight at a rapid pace. You should have your child assessed for a spinal deformity, or toddlers do not have well-developed abdominal muscles.
Information. Yeah, I have.
D.
Oh my, did I miss the question?
What is it?
Wait, did I miss the previous question? The one like after 6 months? I got disconnected.
It was this one, the gross motor skills of a 4-year-old. Which should be able to be, this is gross motor skills. And the answer was hopping on one foot.
That sounds about right.
Okay, so a toddler has a rounded abdomen. It looks, they have that cute little belly. And I see this in a lot of, actually all toddlers. Why would they have a rounded belly?
Because they have not developed the abdominal muscles yet.
Okay, what about a stool softener? Maybe they haven't pooped.
No.
Don't give them that.
I mean, maybe possibility.
Give me
Actually,
that, but don't give
toddlers
them
do.
that.
Toddlers, remember one thing about toddlers, they're potty training. So sometimes they hold their poop in. So this will confuse students.
Mm-hmm. I think my kids, when they need to go poo, their tummy looks a little round too, and then after they go poo, they're flat again.
It just
Mhm.
lines out. So should we do A or D?
I would say D for ATI D.
Anybody else? D. I'm getting D's. Okay, let's see D's. It is D. They don't have well development. So constipation does not cause a toddler's protruding abdomen. They do get constipation, but abdomen shouldn't be protruding. And rapid growth does not cause a protruding abdomen. And then we're not going to jump into spinal deformation. Okay. A nurse is providing teaching to the guardians of a 4-month-old on how to play with an infant. Which of the following play activities should the nurse suggest for this infant? Yeah. I don't want to
Make
give you guys
different
the
farm
answer.
animal sound. And splash.
Okay, so we have a 4-month-old. What should they be playing? A board book with large pictures, a farm animals, push toys, or splashing in the bathtub?
D.
I think the large push pull toy is probably more towards like early toddlers, say like 2 to 4 years old as they're like learning how to walk.
So some people are saying C, some people are saying D.
It's D.
D.
But I want to know why. I
Yeah.
want to
Alright.
know why it's D.
So it's D. And the reason is we want the baby to splash in the bathtub as a play activity. It helps their tactile stimulation. Obviously, we want to do bath safety, so we're not going to leave the little 4-month-old by themselves. And then the other ones are obviously not. The push toy, they're too little for that. They can't stand up on their own yet. Animal sounds is usually most for a 12-month-old. And then the first one, the large picture, is for an older kid too, a 12-month-old.
But I have a question. Everybody's pushing for the earlier you read to kids, the better. Why wouldn't you show the infant even like from day one, like picture books for visual stimulation? I know they're not going to understand it, but it's like this First Five California and getting literacy rates to be earlier. Why wouldn't you start as early as like day one of the baby coming home by reading and showing them pictures?
You do want to, but the question is asking you play activities. Reading to them is not really a play activity. You want something that's going to encourage their finer motor skills and going to help them with play. And that is splashing in the tub. And babies love splashing in the tub at 4 months old. So I get what you mean, and that's going to help their learning and brain development, but it's not really a play activity for a 4-month-old.
So if we see the word play, we should associate it with like motor skills.
Like yes, growth and motor skills, fine skills, the things that help them develop those skills. All right, moving on. A nurse, hold on, a nurse at provider's office is observing children playing in the waiting room. The nurse should expect to identify parallel play in which of the following age group. What is parallel play?
They play against
Preschoolers.
each other, but not with each other.
So they're playing alongside each other, but they're not playing with each other. So preschoolers, somebody said preschoolers. What about toddlers?
No, they don't even like sharing.
It's actually it's B.
So let's break this down. Why would it be B, toddlers instead of preschoolers? I always feel like there's a fine line between a toddler and a preschooler. They're so close in age. Why, like you just said, toddlers don't want to share.
Mhm.
What about preschoolers?
At that age, they
Do
should
they
Sharing is caring.
preschool age should have some kind of sharing skills. If they're in preschool, they're learning how to share.
Okay, so some people are saying B, some people are saying C. Let's see the answer. The answer is B, toddlers. So preschoolers are associative play. So they're already associating, they're playing with other kids. Toddlers, they're maybe playing alongside each other, but they don't play with each other.
Wait,
They're
so
doing
what does
parallel.
parallel play mean? Because I don't
It
think I
just means
understand what
By
that
side.
means.
it means that they're playing, they're in the same room, but they're doing their own thing,
Oh,
but they're next to each other.
Wait, so they're just like doing their own little thing, like playing, like they just
Like let's
like
say
parallelly.
exactly. So let's say you and me are in the same room, but we're parallel playing. You're playing your video games and I'm doing my puzzle, whatever. We're in the same room, but we're not playing with each other. We're doing our own activities. And that's very common in toddlers. By preschoolers, they start doing associative play, which means they start interacting with each other.
I see, I
Okay?
see. That makes a lot more sense. Thank you.
Okay, so we are going back to immunization. We are doing our immunizations to our 5-year-old. What should we give them? Tdap, pneumococcal vaccine, influenza type B, or hepatitis B.
Yeah, it's in the CSL complete.
I want to say either A or B.
It's a page 3.
A.
Anybody else?
A.
Patrick CSL complaint.
A, B, C, D. Anybody? Okay, we want to give them the A. So infants should receive the PCV, and the PCV is the pneumococcal vaccine. And then C, infants should receive the HIV, and then infants should receive the Hep B at birth.
Yeah, and the CSLB complaint has all.
Okay. I know immunizations can be confusing. All right, a nurse is assessing a 3-year-old. What should they be able to do? So this is a 3-year-old. Should they be stacking blocks, printing one letter? Sorry, printing one letter. I guess that's, yeah, the number 1, I guess. Tying their shoelaces or using 7-word sentences.
Definitely not C or D. I'm gonna say B.
Stacking 10 blocks. Anybody else?
A 3-year-old can say a full sentence.
No, not like 7 words. No, like
How many words can they say? Let's go back to that. 500, 2,000. How many words should they be able to say? It's a 3-year-old.
200. 200.
Okay. So somebody said B or A? Anybody else? Somebody said A. Okay, let's see. The answer is A. So they should be able to stack 10 blocks. So they can draw a circle, but they can't actually do a letter. They should not be able to tie their shoelaces. And language development, they should be able to use 3 to 4 word sentences. 7-word sentences are until the age of 5.
So, question.
Years old.
So okay, so yes, 3 years should be able to stack 10 blocks. Like so printing one letter, that's basically constituting that they can write? Like, is what I'm getting at?
Like I said, it is
Okay.
basically what ATI is saying. So they
Okay,
should be able
okay.
to write one letter, but then they're not there yet at all.
Okay, I got you.
I have a question because I think I'm
Yeah.
getting confused because I have comparisons on my children versus ATI. Are we saying ATI is like the general children population who like these kids, like a 3-year-old has never been to school, or like I don't know. I'm getting very, very confused because
That's a good question. And that's what I'm telling you guys. Don't get confused from don't mix your own real children with ATI children. And don't mix what you see if you work in a hospital or in a clinic, what you see from what you see on ATI. This is ATI world right now, and you guys are taking an ATI test. This does not mean that it's hard, it's written in stone, this is what the children should be at. It's an approximate, but because we're doing ATI book, go with ATI. Don't go by, oh, my kid, didn't crawl till this age, whatever. No, this is what we're going by, what ATI is telling. And I can see that that's a problem that a lot of students have. They get themselves mixed up with their own children, their own kids. Oh, well, I didn't see that in my kid. This is ATI. So, okay. And that's what I was discussing with another instructor, because a lot of students that are LVNs tend to do that a lot too. Oh, I don't see that in practice. We're not in practice right now. We're in ATI world. Okay. So a nurse is performing a developmental assessment on a 3-year-old. What commands should they be able to follow? Put your shoes on. Name the days of the week. Cut out this picture with a pair of scissors. Balance on one foot with your eyes closed.
Put your shoes on.
Name the days of the week. What is
Not
it?
gonna lie, I struggled with that till days later, so I can't blame you.
Huh?
Well, years later.
What is it? Anybody? Any takers?
Letter A.
Put your shoes on. Put your shoes on. Good. So they cannot tie their shoes, but they can at least put their shoes on. A nurse is, here's Erickson. A nurse is caring for a preschooler who's scheduled to have a surgical procedure. Which of the following is Erickson's developmental stage? First of all, preschoolers, what is their developmental stage for Erickson's?
Or,
Is it trust versus, okay, let's go. Trust versus mistrust is what?
trust versus mistrust is infant.
infant
Industry versus inferiority is what?
school age. Wait.
Initiative versus guilt is what? Somebody said D. Identity versus role confusion.
That was adolescent.
We just talked, that's adolescent. So we can rule out B and D. What about A and C? Which one would it be?
I'm going to say A.
Anybody else? A, B, C, D? All right, it is going to be C. Initiative versus guilt. So remember, in the preschoolers play activities and experience feeling of guilt if their efforts at independence receive a negative reaction. Okay, a nurse is teaching the parent of a 3-year-old about promoting sleep. So this is sleep. What should we include? Follow a nightly routine, encourage activity prior to bedtime, let the child remain awake until they are tired enough, or reward the child with a fruit treat. The food treat. A. Okay, so we want to do A. Now, why would we not let them tire out? What happens when the child is overtired?
They're not gonna
Can you scroll up a little higher? Let me read the top part.
they're not gonna sleep.
Yeah, so it's kind of weird, but when a child is too tired, they can't sleep. So they're overtired. So we don't want to get them to that point. We don't want to give them stuff to eat before because then they're not going to be able to sleep. And then we don't want to have them active play because then what's going to happen if they're active playing right before bedtime?
Too much energy.
They're going to be
Then
all
they're gonna want to play more, and you're gonna have to deal with an angry kid.
they're going to be all wired up. So we want to get to the point where they're tired enough, but not overtired either. Okay. A nurse is caring for a 4-month-old who is hospitalized. What should we give them? 4-month-old. Boards, toys with movable parts, plastic mirror, or a push-pull toy.
A board book and large book.
C.
A plastic mirror.
Yeah, I'm gonna go with C.
See a plastic mirror, yes. So we want them to learn object permanence again. So we want to show them that that baby is them and this is them. We want to teach them. They're obviously not just learning that object permanence. All right, we'll go over a few more if you guys want, and then we can move on to week 2. Hearing loss. So a child that has a hearing loss, which of the following techniques should the nurse recommend to facilitate communication?
C.
Yeah, C.
See?
C would be good.
Yes, good. Let's see this one. A nurse is teaching a 12-month-old about developmental during the toddler years. Which of the following statements should the nurse include?
D.
D? Anybody else?
Yeah, D.
I'm gonna agree with D.
You're gonna do D? The answer is D. Yes. So why would we not have bowel control by the 12 months, by 24 months?
Because they potty train.
Yeah, usually we start potty training at 2 years old. Some kids do not take a long time to potty train, so we can't expect them to be potty trained at 24 months. Okay. Finger foods. Oh, we talked about this. What are finger foods for a toddler?
A. Right banana.
Yes. And then injury prevention for an infant.
A. Talcum.
Talcum. What's talcum? What's talcum?
I know you just had it on the diaper.
We
No.
just had that. We covered that during.
Yeah.
What is
during the
talcum
integumentary.
powder?
I remember
Yeah.
you used it for like diaper dermatitis.
Yeah, but do we use talcum? That was on your
No,
exam.
no, that was zinc. Zinc oxides for diaper dermatitis. My bad.
So somebody said C. I should make sure my child's clothing does not have buttons. That's good. Oh, I should ensure that the crib slats are no more than 3 inches apart.
They're supposed to be 2.
I should have a drop side crib after my baby is 6 months old. So which one would it be?
C.
I'm gonna choose D.
C?
I'm still
You're
on
gonna choose
A.
D. Some people are going with C, some people are A. Okay. That's a good question because that's gonna come up again. So the answer is C. Obviously, this is an infant, so we don't want to have anything that they can put in their mouth. And then A, why would we, what is talcum powder? Do you know what talcum powder is?
It's like
Is that not
Do you know
baby
what that
powder?
is,
it's
Brandon?
like a powder that yeah, it prevents like
It's baby powder.
it's like a film. It's like it provides like a film over the skin, so the skin doesn't get wet.
Yeah.
And cause diaper dermatitis.
So in the days, they
Mhm.
used to use the talcum powder back in the days for skin to prevent diaper rashes. Now talcum has actually even been removed from the shelves. They don't have it on anymore. It doesn't
Really?
show that
It
it
causes
doesn't. Yeah, you won't.
ovarian cancer. No.
It doesn't show that it does anything to the skin. It doesn't have any medical benefits like Medicaid, it's not a barrier. And you can, as you shake it, it gives you like a cloud. And you can, kids have been aspirating on that cloud, a cloud of particles. So when you shake, it's like the powder. When you shake it, it makes a cloud, and the kids have aspirated on that cloud. So that's why they've actually even
Wait, how
taken it
long
out.
ago did they change from talcum
It's
though?
been a while. It's been a while, actually.
Really?
So
I was
it's
not
not
aware of this.
recommended to put, yeah, it's not recommended to put talcum powder. We don't put talcum powder. That's why we changed to Aquaphor and zinc oxide. Okay. A nurse is teaching an infant about food allergens. Which of the following the most common food allergies in children? Oh, this is good.
D.
Cow's milk, white bread, corn syrup, eggs.
We had this question a few times, I think, in dynamic cuisine.
Was it? Did you guys see it? What do you guys think?
D.
D?
I
Anybody
saw
else?
it, and every time I picked eggs, it would be cow's milk.
A? Somebody said
Yeah.
A. Good. Let's
It's
see.
A.
It is a cow's milk. So it is according to evidence-based practice. So this is evidence-based. It's not our own, from our own knowledge. The food is cow's milk is more commonly cow's allergies. Eggs but it's not evidence-based.
But is that an allergy
So it's
or is that an intolerance?
It's an allergy.
egg,
Like,
egg sometimes is an intolerance because sometimes kids will outgrow. They just can't tolerate the protein in eggs.
No, I thought
Cow's
it was
milk is
milk.
allergy.
Because I've
Yeah.
never seen a patient with a cow's milk allergy, like a pediatric one. I've seen so many with the egg allergies.
Yeah, I agree with you too. But ATI is telling us that according to their evidence-based practice, it is cow's milk. But I do agree with what you're saying, but sometimes the egg is not really an allergy. They outgrow it and it becomes an intolerance. All right. During a well-child visit, the guardian of a toddler the guardian of a toddler reports that the toddler takes several hours to fall asleep. What recommendations should we make? Vary the time the child goes to bed at night. Allow the toddler to watch television. Provide the toddler with a stuffed animal. Increase the toddler's activity. This is kind of similar. Somebody said decrease the toddler's activity prior or increase the toddler's activity prior to bedtime. Somebody said that. So what do you guys think? C? Somebody said stuffed animal. So C or D? Let's see. The answer is C. We don't want to increase their activity because we're just going to get them all hypered and wired up, overstimulated, and they're not going to want to go to sleep.
And also the last question.
Yeah. All right. Immunizations for a 12-month-old. What should they get? Varicella?
12-month-old should get Tdap.
Tdap?
I remember this because I didn't want to get a Tdap in middle school because they're scary.
Okay. Anybody else?
C.
Polio?
C. Hib and polio.
Hib and polio? What about hepatitis A? HPV and hepatitis A, no takers?
That's given at 12
No,
months and 18 months.
All right. Answer is C. Hib and polio. And then HPV should be given at 11 years old. And then hepatitis starts at 12, MMR starts at 12, 14, and then varicella is children not given to children under 12 months old.
I have a question, completely
Yeah.
related, but not like ATI. We give these mixed together with other things. So for instance, like Hib and polio, like that'll be mixed into like Pediarix or Enterix or something like that. Is ATI saying that these are given, or is it possible to give them separately? Like you give the IPB separately and the Hib separately?
We actually give them separately. Sometimes, like I've said before, we have to give them 4 separate vaccines. So we give them four separate sticks.
Like
Sometimes
not
we don't mix them. at the same time, but not mixed in the vial at the same time. All right, moving on. We can do about 5 more of these and then we'll move on to the next subject. Okay.
Sounds good.
A nurse is assessing a 6-month-old during well-child visit. Which of the following more activities should the nurse expect the infant to have achieved? So 6-month-old, should they be sitting alone, stacking objects, picking up small objects with a pincer grasp, or turning back to stomach?
E. I feel like Pentagraph is like 2 months later.
So what is
2 to
the
4 months
pincer,
later.
to review, what is the pincer grasp? What am I doing when I'm doing my pincer grasp?
Thumb and the index finger,
Mhm.
I think.
So I'm grabbing things with my pincer grasp. Okay, good. So should they be picking up objects with a pincer grasp at 6-month-old? No. Should they be turning
Too
from
much
back
coordination.
to
Yeah, they
stomach?
should be turning from back to stomach.
So somebody said D. Let's see. D. So they should be. So a 6-month-old, usually a 9-month-old will be able to sit up by themselves. A 12-month-old may usually try to stack things up. And then a pincer grasp is usually achieved by 9 months old. All right, few more. Okay, a nurse is performing an annual physical assessment of a preschooler. The parent expresses concern about the child weighing 1.8 kilos or 4 pounds. They gained 4 pounds. What is the response? What should the nurse say? Is this indicating a serious problem? It's poor eating
D.
habits.
You say D.
D. What do you
Yep.
guys think? Any other takers? Somebody said D. Brandon says D. D. So the weight will change. D. So this is a preschooler. So remember, they are going up and down in weight. So sometimes they actually lose weight because they're being so active. They're doing so many activities. Okay. So this is a preschooler who is becoming a picky eater. What should we tell? What should the nurse say? During the phase, your child will eat anything that she will eat, increase the amount of calories, keep a diary of the foods your child eats, or provide a variety of fruit juices.
Keep a diary of what food your child eats
diary.
each day. Sorry.
So remember, they're picky eaters. What do we want to do with picky eaters? Should we give them juice? Tons of juice?
No, they need to eat whatever they're.
Only 4 to 6 ounces.
4 to 6 ounces of what, juice?
No, I'm saying like
Good.
that's the like only thing you should give them. Like don't do the juice option, but like keep a diary of what your child eats like every day.
So you're saying keep a diary? Somebody said feed your child anything that she will eat. So if whatever they want, give it to them. Is that what you guys basically are saying? Or increase the amount of calories and water your child consumes.
She's using the dynamic quiz. It's interesting.
So we're going with, what are we going with, guys?
Let us see.
A? Okay, somebody said C, let's go with C. Answer is C. So I can see why people would want to have them eat whatever they want, but we want to do the quality of food versus the quantity. Because if we let them eat whatever they want, then they just gonna pick anything, random thing. Excessive amount of sweet beverages we don't want to give them. So we do want to keep a diary of what they're eating throughout the day.
I was confused because I remember seeing a different question where it was something like they were concerned about the child losing weight. And so
Yeah.
the answer option said something like cater to the preferences, and I'm not sure.
Yeah.
Maybe I'm just confused.
The one that might be like that is probably.
I know what you mean by that question because I saw that question too on an exam from ATI.
Sure.
So, which I agree, because it does say let them eat whatever they prefer, but in this case we want to keep
the
it
nausea.
Yeah.
Okay.
But,
all right.
Like the one you're talking about, Daniel, is the one if they're too nauseous to like eat too much food. So you give them like whatever they want because they're more likely to eat it, like while they're nauseous.
Yeah, no, I remember now. Thank you.
Okay, so we have a 4-year-old child's cognitive development during well child visit. Which of the following should the nurse expect the child to display? So cognitive development. What is cognitive development?
B.
Like
Wait, that's
understanding things and what's going on. So if something's being explained, they understand it.
Okay, so conservation. What
What
is
does
conservation?
that mean?
Development of the super
conservation.
ego.
Isn't
What is
conservation like the
development
same
of the
cup?
super ego?
It's like
What is
everything's
development
about
of
them.
the super ego? And concrete operational thought. Where did we hear that? Who does the concrete operations? Where is that at? We talked about this right now. What age is that?
Piaget.
Piaget. And what age is that?
Concrete operational is either like school age or adolescent.
Adolescent. Separation anxiety.
That one is definitely around infant, like
Okay.
separation anxiety. Conservation is, I would say, more also like around say school age, where they're learning that like, oh, same cup size. If I pour this into this cup, like it's gonna be equal value. So sometimes they might not get that. It's a
So
same
what do we
value.
want to do for this 4-year-old? Any takers?
Oh, it's gonna be development of super ego.
Somebody said B. Okay, let's see B. Yes. So they're understanding right from wrong. They're starting to understand, but they don't understand why of the acceptable versus unacceptable behaviors. And then this conservation is they understand conservation typically develops in a school age child. All right. Are you guys good with these, or you want to do a few more before we go to the next one? Good? Anybody else? Okay, let's go to all right. Week 2, what did we talk about week 2? We talked about children and their families. Do you guys remember? And we talked about musculoskeletal. So that includes casts and musculoskeletal fractures. So let's hear. A nurse is providing teaching about home care to the parents of a child who has a newly applied fiberglass cast. What are we going to include? So what 2 things?
A.
Okay, monitor your child's toes every 4 hours for 24 hours. So is that a correct statement?
Well, compared with the other statements, I feel like that one is the most correct.
Okay. Can we take them swimming? So it's A. So remember, for cast, we want to make sure they don't put anything inside the cast. We want to make sure they wrap it when they go take a shower. They shouldn't be taking baths. What 2 conditions do we monitor for somebody that has a cast or has a fracture? What do we talk about?
Neurovascular, like can they wiggle like their extremities?
Okay. So
Compartment.
what are the 2 conditions we talked about?
Compartment syndrome?
Compartment syndrome, good. And then the other one was what?
Lots of neurovascular.
Was fat emboli. Remember that one? Okay.
This gave me a flashback, yeah.
Okay, so a nurse is preparing to administer oral medication to an 8-month-old. How should we administer? Mix the medication with honey, use an oral syringe, add the medication to the bottle of formula, or place the infant in a supine position.
I'm gonna say C. Because B, if it's like an oral syringe, you're gonna do that like more along the lines of like the cheap or like the sublingual. Like
So you're gonna say C?
I'm gonna say C.
Okay,
Like because I
anybody
wouldn't put
else?
it on the tongue.
I would do B.
Any, you gonna choose B? Okay,
B.
so B. So we want to put it alongside the infant's tongue, not on the infant's tongue, along. Why would we not put it in the bottle of formula?
Because it's too
Only
big.
a little bit of formula if you do that. But
Exactly.
Yeah. Wait,
And
so
what about mixing it with honey?
No, they can't have.
no, you can't have honey.
At what age can they start
1
getting
year.
honey? 1 year. Good. All right.
Wait, so this said alongside, like, does that basically mean like the cheek thing?
Yeah, alongside,
Okay.
not on the tongue, alongside the tongue. So next to the tongue.
Okay, then yeah, that's right.
All right. We have another fiber cast. Which of the following instructions should the nurse give the child and his parents about care during the first 48 hours? Keep the cast level above the heart, clean the soil cast with soapy water, avoid moving your legs and joints above the cast, or use a toothbrush to scratch under the cast.
You are going to want to you wait, what's the question?
Isn't it C because you have to elevate the extremity for 48 hours?
the only one that seems
I
right.
agree with C.
Okay, what about moving the joints above and below and above the cast? Anybody for that one? Why would we want or not to do that?
To promote circulation, as long as you're not like trying to wiggle out of it.
What?
So do we want to avoid moving your leg and the joint above and below the cast? Do we want to avoid that? Okay, so it is C. Obviously, why do we want to keep the cast above the level of your heart? Why do we want to do that?
Because it's already swollen, so you want to make sure that the swelling goes down so they don't get compartment syndrome.
Yeah, so we want to prevent that edema and venous return. I asked about the option B. It is, we don't want to be doing strenuous activity above and below the cast. We don't want to, remember they just had surgery, so we want to immobilize that broken bone. Okay. Teaching for a 5-year-old. What do we want to do if we're going to do teaching to a 5-year-old?
Provide diagrams and pictures
Are we
while
gonna
explaining the procedure.
Are we going to explain the long-term benefits?
Nah, because they
Are
don't know
we-
what long term is.
Absolutely.
What about medical terminology? Oh, you're going to have an open reduction internal fixation of your
Yes.
arm, of your leg. Do we want to go do that?
They're gonna start imitating and start saying blah blah blah.
So D, explain the procedures in terms that the child will feel, see, hear, and taste.
I have a question.
Yeah.
Why would it be D over say B? Is it like a relativity like reason or?
Let's see, because
Because I know
usually,
with the
go ahead. We don't want to use diagrams and pictures because we want them to have that sensation, feel it, because they're tactile learners. So we want to make sure that if we're gonna do that, we're gonna use stuffed animals. We're not gonna really show diagrams because they might not understand anatomy and physiology and all that stuff, you know?
that makes a lot more sense when you put it into that perspective.
Yeah. I mean, diagrams and pictures, if we show them that, they're not going to understand. But if they actually can see it in their stuffed doll, oh, this is the leg, then they might understand better.
Yeah.
All right, a few more. Abdominal surgery. Which of the following pain scales? You guys should know this. This is a 3-year-old.
Faces.
Are we going to do faces?
Can the child talk?
Don't read into it.
I'm still say faces.
Anybody else? Okay, let's see. Faces, yes. Anterior fontanelle. So you have an infant that comes in. The patient's anterior fontanelle is almost closed. So at what age should this child be? She has 6 teeth, able to sit up, can drink from a cup, can say mama and dada. What age
They
is this child?
they
So
should probably be.
what age does the posterior and anterior fontanelle close?
Let's see, posterior it should close around like 2 to 3 months, and
Okay, and then
the
anterior?
anterior should close around I want to say 6 to 9 months.
No, it's 18 months. So the posterior closes at 2 months. Anterior closes between 12 to 18, although it can go up to age 24 months.
Yeah, it can be up to 24 months, yeah, but usually about 18 months or so, 18 to 24. So this kid has 6 teeth, can say mama, dada, and can sit up unsupported. So we know for sure it can't be a 6-month-old because anterior fontanelle should not be closed at 6 months.
Right.
Can it be a 12, 18, or 24-month-old?
I'm gonna say 18.
I would say 18 also.
How many
18 because
teeth?
of the inclusion of data.
What about teeth? How many teeth should they have by 12 months or 18 months? No, nobody knows. Okay, we'll look it up right now. What age are you guys thinking? 18 or 24 months?
18.
I
It's
would
12
say
months.
right in between that.
So this is a 12-month-old. So at 6 months, they don't have any teeth. By 18-month-old should have 12 teeth. So that's why it can be an 18-month-old. And then a 24-month-old can speak in 2-word phrases. So teeth, how many teeth should they have? By 12 months, they should have, 18 months, they should have 12 teeth. And this child has 6 teeth. So that's why it's 12 months old.
Can you go back to the question? I'm sorry, I need to read it again.
Yeah.
Can you scroll up a little bit?
No, this is from the previous one. Oh, okay. Oh, sorry. You know what? I see now what I did. Okay.
The nurse notes that the infant's anterior fontanelle is almost closed. Okay.
So for me, I looked at the anterior fontanelle and then at how many teeth they have. And they can sit unsupported. So usually an 18-month-old should be what?
Standing or even walking.
Standing. Yeah. So they should be past being sitting unsupported. Does everybody get that? Do you guys get it? This was a tricky one. Okay, moving on. A nurse is assessing a 12-year-old during a well child checkup. Which of the following physical findings should the nurse report to the provider?
B.
A 12-year-old?
What's hyperopia?
What is it?
Like vision changes.
Presence of pubic hair, is that expected in a 12-year-old?
That's expected. 6.6 pounds is expected. A 2-inch growth is expected. But considering those are all expected, I'm assuming that hyperopia is not expected.
Okay.
Especially if his vision changes, you'll see eye doctor.
So hyperopia, so you guys have heard of myopia. Hyperopia is what's myopia?
Nearsightedness.
Yeah. So hyperopia is farsightedness. So it is an unexpected finding. So they need glasses barely, basically. All right, let me see another one that we can do. I don't want to do that. Let's see this one. Okay, liquid medication to an infant. How should we give it again?
At the side of the mouth.
It is give the medication on that side of the mouth. Okay, let me see if I can find something that we haven't covered. Okay, how about this one? School age females. What should you see regarding sexual maturation for a school age female? Do they have higher fat content, pubic hair present prior to breast development, ovulation begins after sexual maturation, or menarche signs at the beginning of puberty?
Letter B, my lord. Letter B.
Hmm.
Anybody else?
I uh,
So should they have higher body fat content associated with early onset of menarche? What's menarche again?
first menstrual period.
First menstrual
First
period.
menstrual period.
Will we see pubic hair before breast development? Would they start ovulating before sexual maturation, or menarche signals the beginning of puberty for females?
I'm changing my answer to D.
Hmm?
I'm going to change my answer to D because normally, like with the period, that's like the first sign of puberty.
That's the first sign?
I think it's A, but I don't know.
Yeah, let's see. Answer is A. Menarche is expected to occur in the around 10 to 15 years. Usually, a higher fat body content have been shown to have an earlier signs of menarche.
That's why you can say that girls nowadays are getting their periods in like second, third, and fourth grade because, the childhood obesity rates are skyrocketing.
That makes sense. And breast development usually begins around 8 to 12 years, followed after by pubic hair. So first it's breast development, then followed by pubic hair. And then ovulation increases the amount of estrogen and it develops after menarche. Okay, let's see another one.
So for D, it's like pubic hair, then height, then breast development. Was there
Oh,
like was there like a very specific order to that I was missing, or
there is not. No, there is not a
yeah?
very
Because I was confused on why does D not like signal the beginning of puberty?
It's the end, not the beginning.
The what?
So menarche is like the end of puberty.
No. You will start seeing breast development before you even see menarche. So that's going to usually be the beginning of sexual maturation. At the beginning
So
of puberty.
I
the
thought
first is breast development, then it's menarche.
You get hold on. Where are you going at? I'm trying to understand like how you're trying to base it.
Let's see. What I'm trying to understand is what is the start of say puberty or
What signals the start of puberty in a female? Is that what you're trying to say?
yes.
Okay, so going but through the question here, menarche is indication. Menarche is an indication of late puberty.
Mhm.
So it's a late indication. The onset appears preceded an increase in height, breast development, and the appearance of pubic hair. So they're gonna have height, breast development, pubic hair, and then menarche. Do you see that here?
Yeah, I see it.
Okay. Let me see if I find a different question. We did cast. Do you guys want to? Okay, Atik, this was a question that everybody missed. So we are giving an 18-month-old Atik medication. What is Atik medications?
Ear meds.
Ear. So how should we do it? Administer the drops immediately after removing the medication from the refrigerator. Place the child in a seated position with the head tilted to the side. Gently pull the ear cartilage down and back, or position the medication bottle so the drops do not touch the side of the ear canal.
Down and back.
What about removing, giving after removing from the refrigerator?
No, you want a room temperature.
It'll end up giving them like nausea and vertigo.
Okay, what about putting them in a seated position with their head tilted to the side?
You have to pull it down and back to straighten out the ear canal or the pinna or something.
Okay, what about putting them, sitting them upright, and then tilting their head to the side? What can we do that for 18-month-old?
Wait, let's see. Like, no, not the side. That's for like older.
What would happen if we give them to them like that? What will happen to the medicine if we put them to the side, especially a
Does,
toddler?
does it just fall out?
Yeah, it's just gonna come out. So which
They
one did you
explode.
guys say? C?
See, I remember. Well, that's the thing. I don't know about everyone getting this wrong, but like, I'm pretty sure we all put that, but it's still marked it wrong.
That was ATI when I went back to read the book. I don't know why the book marked it that way, but
Yeah,
the answer is C. We want to do it down and back. What if it's an older kid, over 5 years old? What do we say?
then just back it up.
Mm-hmm. Okay.
Like, here's a way to think about it. Three up, three down, back down.
All right, let's talk about Pavlik harness. Did you guys remember Pavlik harness? What is the Pavlik harness?
Isn't it
So
the
nurse is teaching the parents about Pavlik harness. Which of the following statements should correct states understanding of the teaching? I will apply the harness over a t-shirt and knee socks. I will put the baby's diaper over the harness. I will make the required harness adjustments as my baby grows. I will apply powder around the harness buckles each day.
First off, not C because that's the doctor's job.
Good. Good. What about D? So what in the Pavlik harness, what is our number one thing that we have to do?
Yeah.
Protect the skin. So do we want to put any type of lotions or creams or anything on the buckles at all?
Is it protecting the skin?
We want to do skin assessment, but we don't want to put any type of creams or powders or anything. What about A or B?
I don't think B makes sense. Like, why are you putting the like diaper over the harness? Isn't it? Aren't they just gonna poop on the harness then? And then that's gonna cause like a buildup on the baby's skin anyway.
Okay. So what do you guys think? A?
I think A. Compare with all these answers, A them.
So A. So remember, we want to put the diaper under the harness. We want to, only the physician can do any adjustments and no type of lotions or powders on the skin because that can cause more irritation. So we do want to put a t-shirt or socks to protect the skin. Okay, let's see. Oh, how about a child that ingested bleach? Which of the following statements made by the nurse indicates an understanding of this ingestion? The absence of oral burns excludes the possibility of esophageal burns. Treatment focuses on neutralizing of the chemicals. Injury by corrosive liquid is more extensive, or immediate administration of an activated charcoal is needed. What does bleach do? What can bleach do?
It burns you.
It burns, so it
Burns
can
your
burn
inside.
the esophagus, okay? So do we want to give charcoal? What is charcoal gonna do?
Might aggravate that more.
Yeah, usually that initiates vomiting.
Well, first
we-
with any like chemical treatment, your goal should be to remove the chemical first. You're taking off the clothes off the client. You're washing off the medication. You're not medication. You're washing off the chemicals first before like you're like treating it because the longer the chemical stays on, the more damage it's gonna do.
Okay, so in this case, the child drank bleach though. So how are we gonna neutralize that?
Try to
Or
remove
how-
the bleach from the system.
Okay.
The way I understand this question, it's saying what statements by the nurse indicate an understanding of this ingestion, not asking what the next
treatment.
step would be. It's basically getting like the baseline of what do you know about this ingestion, not what do you know about the treatment.
Okay.
I was
So,
going to C as well because in the lecture or in the book somewhere it says that because the liquid can cover more surface area, it can be potentially more dangerous than like a solid, kind of piggybacking off of Erica's thing.
okay, interesting. Okay, so let's see what the answer is. The answer is C. So like you said, Daniel, the liquid actually it comes in contact with more tissue and can cause more injury. We want to neutralize it, but that's not what the question is asking. Then charcoal should not but be a given, because it can actually cause more burning of that tissue. Okay, let's see. Okay, I think I had this in one of the exams. A nurse on pediatrics is caring for a preschooler who is prescribed an IV medication. Which of the following actions should the nurse take to prepare the child? Use role playing, provide the child with detailed explanation, implement interactive sessions of 30 minutes with the child, give the child an identical IV supplies to play with.
The
So
both of
we
them
are
would be
going to
familiar.
put in IV medication. We're going to give them identical IV supplies. Is that what you're saying?
Yeah, just so like they could be a little more familiar and less afraid with the device.
Yeah,
Okay.
but if it's identical, you're saying that it's the same equipment we would use, which you
So
wouldn't
are we
use.
gonna give them a needle and everything?
Well, no,
If
like
it
Yeah,
said, if
because
it said play IV supplies, then I would say that too.
yeah,
you do have like toy ID supplies.
Yeah, because right now
Mm.
what you're saying is you're going to give them the thing with the chamber and huge.
Then
yeah.
the next case scenario would probably be use role play activities with the
Okay,
child.
let's see. Use play role activities. Why would we not choose D? We want to allow them to familiarize, but give them an identical supplies is a safety risk, and they can actually be injured by the needle. So yeah.
Yeah, I was not expecting the nurse to actually give them the needle setup.
So unless it's a play needle, we will not give them a needle to play with. Yeah. Okay, so let's
Plus, it would specify.
You guys already kind of okay. So IT mental pain scale, what should it be?
Black.
It should be flag. Okay, let's move on to our next week. Hold on. All right, here we go. So week 3, we talked about tonsillectomies, respiratory asthma. Okay, so we have a child that is post tonsillectomy. You know what? I don't want to do this because we already talked about that. Rubella. Which findings should the nurse expect for rubella? Oh, I like this question. Strawberry
Strawberry
tongue.
tongue is Kawasaki. That one's
Okay.
Kawasaki.
What about D?
You're
What
gonna
is that?
expect the couplet.
What about paroxysmic coughing? What is
No.
that coughing in what kind of situation we see that coughing for D?
Status asthmaticus.
Mm-mm.
Oh.
Whooping cough?
Whooping cough. Good. Couplet spots. What condition is couplet spots in?
Measles.
Is that in measles like rubiola?
Rubeola or rubella? Remember, there's
Rubella is a different thing.
Okay. So remember, one of them you can see an enlarged parotid gland, and another one will be couplet spots. Which one is it?
Rubella is German measles, so it's couplet spots.
Okay, so let's go with couplet spots. Couplet spots, good. Swollen parotid gland is mumps. Strawberry tongue is scarlet fever, also Kawasaki, and then the coughing is pertussis or whooping cough. Good.
Had me in the first time.
Let's see. Meningococcal meningitis. What isolation?
Are those
Airborne.
that's meningitis isn't droplet, right?
No, I don't think meningitis is airborne, but that's just because I'm thinking of like an analogy called VMA awards.
Anybody else? Any takers? All right, it is droplet precautions. So any type of meningitis will always be droplet precautions. Let's see. Mononucleosis. What did we say mononucleosis is, you guys?
Epstein-Barr.
Epstein-Barr, also known as the kissing disease. So they are going to gym class. Why should they be excused from gym class?
A. Spleen.
A,
Download that
spleen.
Okay.
what you want over to your anchor PDF.
Yes. So remember, they have splenomegaly, so they are at high risk for spleen rupture. So they cannot go to they cannot participate in contact sports like that.
That should be your complaint. That should be the front.
Okay, so you are working in the pediatric unit and you're getting these 4 patients. Which one should you put on droplet precautions?
D, my lord, D.
Your document, so I would just take that document that you're.
Some of them we haven't even.
Pertussis.
Pertussis? So pertussis, yes. Rocky Mountain fever is a type of bacterial infection caused by a tick bite. And they usually use standard precaution. Roseola is a viral infection with herpes in family. And usually you'll see a rash. And this contagious is caused by poxovirus and its flesh-colored papules on the skin.
Can you remind us which disease goes with the airborne and the droplet?
Okay, so let me go to my PowerPoint so we can review that really quick. And then I'll show you guys. Hold on. Actually, let me grab mine.
So, how's everyone's day while we wait?
What is it?
Oh, never mind, you're bad. I was asking how everyone's day was like while we wait. But we're back.
It's okay, you guys can discuss while I'm pulling this up. Okay. So it gets confusing here because they kind of all seem similar. So let me go to this. Hold on.
Just make sure varicella is airborne, right?
Yes, good.
Oh, varicella and what?
Okay, so 5th disease. Do you guys remember what fifth disease is? I'm trying to.
Parvovirus?
Parvovirus. Who said that? Parvovirus?
Daniel.
Daniel, good. So usually these kids might have to be on droplet precautions. We talked about whooping cough. Okay, whooping cough is droplet isolation.
No, just open it.
Mumps is droplet isolation.
Document update.
Measles, airborne negative pressure, your N95. Rubella is also droplet. And then varicella is your airborne. So there's only 2 that are airborne. Is usually your varicella and your measles. Everything else is going to be droplet. And that's where it becomes confusing.
I have letters that say.
Good. Some say VMA awards.
Did you pick up where it left off and say?
Correction. Everything else is I'm gonna retype that. Everything else is droplet. Everything else is droplet. I'm so sorry.
Letter.
Everything else is droplet. Yeah, not everything else is airborne.
Your Word document, Control P, click the PDF.
Okay.
Save it as like update.
Can you? Okay, so let's go to the next question.
Not you. I don't understand where you're at.
Okay.
I don't know.
You said you knew what to do.
How is this? Okay, this question. Let's go to cystic fibrosis.
I've given you all the information. We sent the text, we sent the text, we sent an email.
Okay, a nurse is providing teaching to a child about managing to a cystic fibrosis kid. What do we need to teach them? Pulmonary cleans can help prevent the need for lung transplant when you get older. You should eat these kind of foods, especially when they help you grow big and strong. Your mucus becomes thick in cystic fibrosis, or your medication follows a certain schedule to help you sleep better. So what do we want to teach kids of cystic fibrosis?
C.
I want to say C. Yeah.
Which one? C? Okay, let's see. C, your mucus becomes thick during cystic fibrosis. Good. You have a child who has pneumonia. What in this experiencing separation anxiety, what should you expect?
You should expect them to attempt to escape and try to find a parent. Wait. Well, how old is this kid again?
This kid is 4.
Oh yeah, definitely. Attempt to escape and try to find a parent.
Okay, so it is inactivity and thumb sucking. So you have a child, 4-year-old child. The mom left 2 hours ago, and now he's having separation anxiety and despair. He's in this despair stage. So usually when they do this is they are the second stage of separation anxiety is despair. The first stage is crying and screaming. And then the third stage is happy and interacts with strangers. And then the first stage is trying to escape. So they are in the despair stage, where usually they will regress and they start thumb sucking, even though it's a 4-year-old. All right, let's see. Cystic fibrosis, rectum. Which of the following is the cause of this complication of prolapse rectum? What do you guys think?
Oh, a prolapse. What?
Prolapse rectum.
I'm gonna say A, both these foods.
Any other ones, you guys?
I'm so confused. They have CF. Wait a minute.
So remember, they have cystic fibrosis and then they have a prolapse rectum. What is the cause of the prolapse rectum?
B.
B?
Yeah, honestly, either A or B.
So it's bulky stools. So bulky stools can cause cystic fibrosis kids to get prolapse rectum. Remember how are the stools? They're bulky, they're foul smelling.
They're big.
So a weakened rectal sphincter is not a manifestation of cystic fibrosis. You won't really see a weak sphincter.
That's what
What
I was
is it?
confused with. It was mentioning CF and the prolapse. I wasn't sure if they were referring to for the complication that if they were referring to just the rectum or how they both, I guess, are interconnected. That was kind of weird.
Are interconnected, yeah. So it's just saying, why does a child with cystic fibrosis mostly have prolapse rectum? And it's because a child with cystic fibrosis will usually have the bulky stools.
I thought it was fatty stools.
Yeah, they have the fatty, bulky stools, yes.
Okay, so it's bulky too.
Okay, let's see what else I have here. Okay, so you have a kid that's coming in with this crust around their nose and mouth, and it is lesions caused by impetigo contagiosa. What should the nurse anticipate the children to teach the children about? Do we want to give them antibacterial ointments, change the linens, administer acyclovir? What is acyclovir used for?
Cyclovir is used for was it HIV?
Mm-mm.
It was chlamydia.
Well, if it's oral suspension, it's for like lesions in the mouth, correct?
Yeah, good.
Herpes.
Herpes or sometimes varicella.
Okay.
So what do we want to teach the parents to do?
Well, I mean, it's spread by contact, so I would say wash. Oh, it's select all that apply.
Oh, there's more. Definite one of them. Definitely C. But this is in Pedigo. So this is like crusty stuff.
Okay. So do we want to apply antibacterial ointment? So would this
Topical.
be topical?
One of them topical.
Okay,
I'm not sure
so
about C anymore.
okay, so it is going to be A, which is apply antibacterial ointment. It is going to be B, which is wash the child, and then obviously E, wash hands before contact. So this is a bacterial infection. It is not a viral infection. C would be if so this is aceclidine is for antiviral. This is not an antiviral infection. This is a bacterial infection. And then allow the crust covering the infected lesions to remain intact. What does that say? So we want to wash the crust every day with soap and water to promote healing. I know usually they say leave the crusts alone, don't touch them, but in this case, you want to wash them with soap and water. Do you guys get it? Understand it?
Yes, we do.
Mhm. Okay, here we have epiglottitis. What is epiglottitis? So we have a toddler who's in respiratory distress. Which of the following should alert the nurse to possibly epiglottitis? Lethargy, spontaneous coughing, drooling, or hoarseness?
I'm gonna take a guess and say B. Either B or D.
B or D? What about C?
Respiratory.
I remember
what's
one with
happening?
drooling, but I don't remember which one.
I
What
would
is
say
happening?
drooling. I would say drooling because if they have inflammation that's possibly blocking the majority of the airway, like they don't really have much in the movement, so it's just going to be like uncontrolled.
Okay, let's see. It is C, drooling. Good. So it is
What is
caused
this
by
one?
inflammation of the epiglottis. And then remember, what is that position that they are in?
Tripod.
What they have tripod position. And what should we prepare for if they are in these positions?
Difficulty
What is
breathing, respiratory distress.
their airway is closing, so we should start preparing our emergency supplies for possible intubation. Okay. A nurse is creating a care plan for a preschooler who was admitted for the treatment of measles. Which of the following activities should the nursing care in the client's plan of care? So we have a kid that's in measles. What kind of isolation are they going to be in?
Airborne.
What isolation is measles? Do you guys remember?
Airborne.
So measles is airborne. Good. Okay. So what are we going to include in their plan of care? So they're going to be stuck in a room, bored. And it's a preschooler. So what activities should we give them?
As much as I want to say video games, you want to have them on D. Putting together a puzzle with large pieces.
Okay, I see what you're saying, video games, but you're not reading the whole sentence. Playing a video game in the playroom.
Oh no, they're outside. No, yeah, I was saying as much as I want to say because, yeah, but my answer is large pieces.
Large pieces. Anybody else? Okay, so let's see. It is large puzzle pieces. So read the questions, read the answers, because you just went with video games, but you didn't see the playroom part.
Oh no, that's why I said as much as I would love to put video games, like as much as I would love. That's not what I meant. Yeah.
Okay, we have a child who has an exacerbation of cystic fibrosis. What laboratory findings should we notify the physician of?
Wait, aren't they supposed to be losing sodium in cystic fibrosis?
Mhm.
I'm gonna say oxygen saturation 85%.
B.
Okay,
Yeah,
anybody else? B? Yes, okay, good job. Let's, a couple more and then we'll move on. Oh, HIV. What should we expect to see in HIV? A child that has HIV.
A.
Yeah, particularly.
D, chronic diarrhea. Chronic diarrhea is an expected finding for a child who has HIV. Petechiae is not a manifestation, jaundice is not a manifestation, and failure to thrive are expecting findings who has HIV.
What disease? I thought petechiae was prevalent in HIV, or is that AIDS?
I think it's full-blown AIDS by that
Oh, okay.
time.
Okay.
Yeah. Okay, nurses caring for a toddler who has high pitch cry, irritability, and vomiting. What should we which of the following should the nurse take?
You should give them 81 milligrams of aspirin.
What can aspirin cause to a
Like,
child?
no, Ray syndrome, Ray syndrome.
Good. So do we
Huh.
want to give aspirin?
Never mind. No, I was thinking of a whole
B.
different question.
B.
Yeah, give.
A cold bath? Okay.
Actually, it should be a tepid bath,
It
but
should be a tepid bath, yeah. Pad the rails of the toddler's bed. Why would we do that?
febrile seizure precautions.
Mhm. So what were you guys thinking? So he has a high-pitched cry. That tells you a lot right there. What could that mean, high pitch?
Isn't that bacterial or viral meningitis?
Exactly. Mhm. So
So
let's,
we're on seizure precautions.
yes, seizure precautions. Look at the symptoms they're giving you. Fever, high-pitched cry. Every time I look at high-pitched cry, I always think immediately something neuro, irritability, and vomiting. Do you guys get that? So we want to make sure, we don't want to lay them flat. Why not? In a
Because
supine
then they're gonna have a
position.
hard time breathing.
They're gonna aspirate on their vomit.
Yes, but also we don't want to increase the possibility of ICP because they might have meningitis. So we don't want to increase their because they look from the signs and symptoms. I'm looking at this kid, it looks like meningitis to me. And of course, aspirin, we want to avoid Rey syndrome. So look at your symptoms that they're giving you: fever, high-pitched cry, irritability, vomiting. What are those a sign of usually? Meningitis, especially with the high-pitched cry.
A sign that their airway's closing.
Yeah. No, not that the airway is closing, that there's something neuro change going on. Remember, a high-pitched cat-like cry is usually a sign of a neural thing going on.
Oh, that's like also why there's like a high pitched cry when there's like a NAS for neonatal.
Okay. We have a child that has otitis media. What is otitis media?
Something to do with the ear.
Yeah, infection. Okay, so what should we ask the parents to know? Anyone smoke around the house? Have you given your child aspirin? Is your child dying gluten, or does the child wear a hat outdoors?
B.
Okay.
Be.
Why would we say B?
Because secondhand smoke can cause immunosuppressants or immunosuppression in a child, and ear infections have been proven to be secondary to secondhand smoke.
Okay. And also, secondhand smoke can cause upper respiratory infections in children. which can also cause ear infections. So usually when you have upper respiratory infections, they are usually associated with a child's ear infections. Good. Okay, good. Let's look at this one. We have a child that's coming in with influenza. What should we report to the physician? And this kind of goes with what we just learned right now.
Influenza.
Okay, so yeah.
How does
Uh,
influenza have to do?
See what what he says, I don't see a reason why
Okay.
I'm sorry, you're cutting off. What?
that. So
No, go ahead. So you have a kid coming in with influenza. What should we report to the physician out of all these labs?
Is this select all that apply?
No.
If it's related to influenza, it would be C, but you can also, D is also reportable too, if it's an adolescent.
okay.
Mhm.
What about A? Is also reportable because isn't that above the range for
So you're having in several children come
But
in with the
C
manifestation.
isn't something directly tied to flu though, so I would think C because it's past the threshold, right?
Yeah, C is pretty.
That's
That's
the
a
thing.
really
They're
high.
all out of balance.
Well,
A
the
is
BU, the specific gravity is borderline. It's a little high, so it's not too bad. The BUN and creatinine are also a little high.
We don't have sisters like together.
This one they tested positive, okay. But this white count is double, even almost triple the regular.
Like
So let's
D is like if
see.
they're pregnant.
So, I don't. I'm sure he.
So D tells us that she is pregnant.
Right.
So C is giving us a white count of 24, which could be a sign of possible, and if this kid's coming in for influenza, it could be a sign of pneumonia.
Oh my gosh.
Do you see that?
So, yeah.
Okay, let's do one more and then we'll move on to cardiac. Asthma. Peak expiratory flow meter. What do we want to teach? What is the flow meter? The peak expiratory flow meter.
They measure how hard you blow.
What does that tell us about asthma?
Good airway.
total lung capacity.
I mean, it's probably a good thing, the innocence, but then again, the innocence.
Okay.
Yeah, no, I'm sure.
Okay.
I'm sure he
Okay.
probably was.
So which one of demonstrates an understanding of the teaching?
Not C because you use the highest.
Right.
It would be B because you don't just stop your medication even if you're feeling better or everything's normal unless your doctor discontinues it.
I don't think he'll ever do that again. No, Murphy.
Okay.
All right, thank you.
What about A?
All right, bye.
Does the peak flow meter does it have medications or anything in
No,
it?
it doesn't. It's just measuring like how much lung capacity you have. It's not meant to
Okay.
If
full on treat you.
if it's A, it
Okay,
could be during like an asthma attack, so it could be A too.
Okay, so let's see what it is. It is B. So we always, like you said, we want to keep taking our medications, even if we are in the green zone. The A is not going to, even if we're short of breath, it's not really going to give us anything. When we're feeling short of breath, we're going to need our bronchodilators, but it's not really going to give me anything. And then D, the yellow zone, it indicates that there is impending asthma attack. So we're not controlling our asthma as we should be.
So when looking at a
All right,
question,
last.
Like that, how do you not overanalyze the answers? Because I looked at A and I thought, okay, well, maybe short of breath, that could be an asthma attack. We are talking about an asthma patient. I chose B first, and then I thought about A. How do we like look at these questions and kind of take things like at the surface level rather than looking into it and saying, well, short of breath can be asthma attack?
Mm-hmm. Yeah, you want to look at key things. For example, managing asthma. Data right there will tell me, oh, that I am doing something that's keeping my asthma under control. And I get what you mean. We do tend to read a lot into these and start formulating things in our mind. But if you just look at those key questions or key statements, that will help you answer the question and not go back and have you change your answer. It's kind of hard with these questions, and I get what you're saying, but look at those key points. Like you just said, managing asthma. I am taking my medication to manage my asthma. But if you, yeah, that's you just have to look at key statements in the question, which can be confusing. Let's see another one. Another question about flow meter. Which of the following responses by adolescent indicates understanding of the teaching? How should they do their peak flow meter?
You should record the highest with 3 attempts.
Okay. So it's D. All right, let's move on to cardiac because that's where I know a lot of the questions derive from, and see what they say. Okay, so you have a patient that is taking digoxin and Lasix for the treatment
She
of
looked
heart
at that.
failure. What findings should the nurse report to the provider?
That potassium
So you
one.
have a baby that is potassium.
That's the one that relates
Okay.
mainly to the heart.
What about sodium?
Within range. Or
It's within range.
Yeah, it's within range. It's 135 through
Okay.
145.
potassium for
Good.
the
Okay, so potassium is the correct one. Good. Let's talk about this one. And I want to do one cardiac. This is a math question. Let me see. Oh, tetralogy of Fallot is experiencing a hypercyanotic spell. What
Hey,
should the nurse?
I'm sorry. You said TOT, and I remember slide that infant on your knee.
Does that everybody agree to place the child in the knee chest position? What if it's a toddler, an older kid? What position will we place them in?
Squatting
Mm.
position.
The what? Squatting.
Squatting.
Good. Actually, let's do this one later. Congenital heart disease. What is the risk factor for congenital heart disease?
B. Wait, never mind. Let me read it. Oh, this is maternal risk factor.
Mm-hmm.
I'm gonna go back and say B.
Okay. Alcohol consumption is B. Yes. Ventricular septal defect. What should you expect?
B. Murmur at the left sternal border.
Anybody else? How about cyanosis?
Diagnosis that increases with crying. Um, that would be I'm blanking. I need help.
What about a wide pulse pressure? Where do we say wide pulse pressure is?
Wide pulse pressure is like a septal defect, no?
What defect is that? What congenital heart defect is wide pulse pressure?
That's not the coarctation. No.
Correlation, Erica, is like a what? Like warm bottom, like cold. No, no. Warm top, cold bottom. So it wouldn't be
Yeah.
correlation.
Yeah,
good.
isn't that when they're switched? The arteries are switched or something like that?
Quadricortation, no. Quadricortation is when there is a narrowing of the aorta. So that's why you have a warm top and cold bottom. Somebody said PDA. PDA is for wide pulse pressure. That's good. That's correct. So let's see. What did you say? Murmur at the left sternal border? Is that what you're saying?
Yes, sir.
Okay, it is murmur. What about a diastolic murmur? Is it usually a atrial septal defect? Cyanosis is atrioventricular canal defect, and then wide pulse pressure is PDA. Good. Okay, you have a child with a skeletal traction. What of the following should the nurse take? Rest the child's tractions on the floor. Ensure the child's tray contains no high fiber foods. Perform ROM exercises on the involved joints, or place the child on a pressure reduction mattress.
First off, the weight should not be touching it.
Okay, so that rules out A. What about the rest?
I'm gonna say D.
You're gonna say D? Okay.
Let's see. Yeah, I'm gonna agree with D.
So why would we make sure that there is high fiber foods on the tray?
If they're not moving, they're gonna be bed rest.
Yeah, and what does that
Yeah,
lead to?
no motility, no peristalsis, and no poopies.
So that leads to constipation and backup. And then do we want to touch the involved joints? If they're in a
No.
traction, no, we're gonna make things worse. So obviously pressure reduction because they're gonna be on a bed. Good. Okay. A heel puncture. Let's not do that one. I want to do cardiac. Okay, cardiac catheterization. What should we provide to so this kid is 30 minutes post cardiac cath. What should we report to the physician? Oops. The child arouses to verbal stimuli. The pulse pressure, the pulse strength of the child's left is decreased. The child respiratory rate is 20, and the child resists pain 7 out of 10.
I would say probably the child's pain being at a 7 out of 10.
7 out of 10. So they did the cardiac cath at the left femoral artery. So where should we assess the pulse? Left or right?
On the right.
On the right or the
Wait,
left?
hold on. Let me reread it. Left femoral artery. Oh no, it should be on the left. For this one, I'm between B and D.
Anybody else? Okay. So we're gonna go with the answer is B. If they went up through the left side, we're gonna assess the left pulses. If they went through the right side, we're gonna assess the right. So in this case, the strength of the pulse is decreased. Why should we report that to the physician? What does that mean?
It's not getting adequate circulation.
Yeah, it's not getting adequate blood flow. The kid is at danger for getting a what? What is the biggest complication that they can get post cardiac cath? What is that bruising called? A hematoma.
A hematoma.
Yes. So if we have decreased blood flow to that area, they can start getting bruises and they can develop a hematoma. So they can develop, a hematoma or a thrombus. So that's why it's very important we assess those pulses and report any changes. What other things do we do with cardiac catheterization?
Oh, we just emailed it back to me and
Do you guys remember?
Can you repeat the question?
Huh?
Can you repeat the question, please?
So if we have a child that has a cardiac cath, what else do we want to monitor them for? What is our routine post-op care for cardiac cath?
or you can type your name. Just type your name.
Remember, we want to flush out all that iodine. So what are we gonna do?
Oh, we're gonna give them hydration so they can get rid of it.
Yeah, we're gonna monitor those pulses. Are we gonna have them do range of motion and move that extremity?
No, because they just got it installed or
Word doc,
in place.
Because they just got that catheterization.
but an alternate
Do we need to go back to see that PowerPoint?
contractor. So I wanted to put that in.
Let me go see. Hold on a second. Let me pull it up.
Oh, so do you want me just to scribble on it and send it back to you?
Okay, let me share the screen. Hold on.
Okay.
Okay, so you guys remember when we have a kid that has cardiac catheterization, it's all the way back down here. Okay, so remember, we want to make sure we keep the dressing dry and intact. We want to limit movement of that extremity. Why do we want to prevent movement? Well, what we call, remember, this is going through an artery. It's going through a big artery. So what don't we want to cause the child
Oh, you could just put.
or an adult?
Pain, bruising, hemorrhage. I don't know.
Yeah, bruising and hematoma. We can cause this. So the arm needs to be immobilized. They cannot be moving their arm or their leg if they just had a cardiac cath. Again, we have to give them liquids. We have to make sure they drink to flush out all that contrast, and we have to do assessment of those pulses.
I'm trying to do stuff that literally.
Do you guys
I've shown you.
remember this stuff?
I don't want
Is
your-
it coming back?
don't want your-
It let's see. Everything except cardiac catheterization. Well, I remember cardiac catheterization, but I also remember not understanding
Go
it.
find fire.
Okay,
Like,
why do you have a hard time understanding it? What is it about it?
I don't know what I do.
I have a hard time visualizing what it is.
Why I was vomiting.
Like, is it like you put a catheter inside like
I'm so
a
stressed
valve
right now.
and like
I can barely breathe.
um and like does it promote better blood flow?
So you're basically gonna go like right here through a artery or to a vein. You're putting a catheter, literally like you're doing a Foley catheter, but instead of going into the bladder, you're gonna go into the circulatory system. This is gonna travel either to their heart or brain, but I'm not gonna go into that. And it's going to do repairs. For example, if they have some type of hole like in the ventricular septal defect, they can
Oh my.
patch up that hole with a cardiac catheterization.
Oh,
So you avoid, this is almost like avoiding like open heart surgery by going in and doing it this way.
I see. So it's catheterization, not cauterization,
No,
right?
it's not. Cauterization is something completely different.
Okay, because whenever I read this in the example, I'm like, that doesn't sound like cautery.
No, I am
So
basically, the doctor is basically going in through this big artery to the
yeah,
heart and fixing something. For example, let's say that they require stents because their cardiac arteries are clogged up. Instead of
yes.
opening them up, which is called a cabbage, they want to do the least invasive methods, which is this. And they go in, they put in a stent to hopefully open up those arteries and prevent an open heart surgery.
Open heart surgery. So that's like the least invasive thing they could
Yes.
do
Obviously,
whenever
if
doing heart
that doesn't
catheterization.
work, then they're going to have to do more aggressive procedure interventions, but they want to do the least aggressive. And that's why they put in this long catheter. It's very long, obviously. It's going to follow the pathway of the artery or the vein where they're going to go through and go to the heart and fix that part of the heart that can be fixed with the catheter.
Ah, I see, I see. Okay, thank you.
So if the child, which is why it's so important that since this is a tiny little hole that they make to put in this catheter, it's probably the size of maybe I don't know, like a small pinpoint. It's not a big hole. But it is very important to make sure that you don't get any bruising or bleeding, because what can happen, remember, this is the circulatory system. What can happen if a bruise or bleed happens in this area? It develops into a hematoma. And that hematoma can develop into a huge blood clot. So that is why we want to avoid these movements of these arms and legs when they go where they go through, because we don't want to get those big clots, those big hematomas. Do you guys, is that a little bit more clear?
Yes, that is very clear. Thank you.
So when they go in through this cardiac catheterization to the heart, they use an iodine, which is basically like what they're using to visualize the structure. It's a dye that helps them visualize what they're doing. So it's very important we flush that out with liquids and have them pee it out. Okay. All right, let's move on to our next question. We're done. Okay. All right, so you have a child that, oh, we already did this. You guys already know tetralogy of phallic questions. I don't want to go through that. I want you guys to, okay, Kawasaki disease. A nurse is providing teaching to the guardians of a child who has Kawasaki disease. How do we know the parent has understanding of the teaching? My child will be irritable for the next few weeks. I will notify the child if the skin on her hands or feet begin to peel. I will ensure my child does not receive any live vaccines. I will keep a record of my child's temperature. My child will have joint stiffness at the end of the day. So what do we talk about Kawasaki disease? What does it do?
Well, it's hard to treat. Well, first off, it's hard to treat because the kid's always irritable.
Okay. What else?
Let's see. They're immunodeficient. They have stiff joints.
Okay. What are the manifestations, the phase? There's three phases, the acute phase, subacute, and convalescent. What symptoms will the child manifest in the acute phase?
The strawberry tongue?
Strawberry tongue, yeah. What else?
Redness.
Redness where?
On the body.
In specific areas.
Face. Let's say face. Face and abdomen.
What about the eyes?
The eyes are gonna be more yellow, like jaundice.
Um,
Or is it more red?
Reddish. What about the palms of the hands and feet?
They're gonna peel.
Peel, good. What about fever? How many days are they gonna have fever?
Isn't it like a fever lasting longer than 2 days?
All right, let's go back to that. Let's go back to that. Hold on. Where was it here? All right, let's go back to that screen. We need to review Kawasaki. Okay. So here's Kawasaki disease. It is not a congenital heart disease, so they are not born with Kawasaki. It is an IV and IV. I will give you guys that. It's an autoimmune issue. So they're gonna have fever for more than 5 days, the strawberry tongue, enlarged lymph nodes. What are they at high risk of? What is a child with Kawasaki at high risk of? It's right here, you guys.
Cardiac aneurysm.
Cardiac aneurysm. Why are they at high risk of cardiac aneurysms? Because of what's going on in their body. They're having the systemic,
The vasculitis is inflammation of the vascular system, I guess.
Yes, exactly. So they're getting this vasculitis or this inflammation of their circulatory system, which makes them a high risk for aneurysms. So then you have your acute phase. which is what we just talked about. The red hands, the red palms, the red eyes with no drainage, the strawberry tongue. And then we have your subacute, where they're more irritable, but they still have this arthritis. And then the convalescent phase. What is the treatment during the acute phase?
IVIG.
IVIG, good. What about the subacute phase? What is the
High dosage of aspirin.
Good.
That was the one.
Yes. I know somebody asked me, well, what about Ray's syndrome? But in this case, it's not, this is not related to influenza. Remember, Ray's syndrome is usually in what season will we see Ray's syndrome?
Wait, what was the question? What was your question?
So when kids get Ray's syndrome, it's usually related to giving aspirin with what type of infection?
Viral infections?
Yeah, influenza. But this is not an influenza related thing. It is an autoimmune thing, which is why we are giving, it's okay to give aspirin.
I want to ask, like, is it just influenza or is it viral infections?
It's usually mostly in the flu season, so it could be any type of upper respiratory infection. It could be viral or influenza.
Okay, I got you.
Okay, so let's go back to our Kawasaki question and see what it says. Hold on. Okay. So it's saying what it indicates correct understanding of the teaching for Kawasaki disease. Select all the apply.
Isn't the notifying doctor about the begin appeal not correct because like the peeling is expected with Kawasaki disease?
Okay, so we could choose B. Anything else?
Wait, choose B or rule out B?
It's select all the apply, so you can choose whatever you guys want.
Okay, because I wanted to choose A, C, and E. Because A, like your child's gonna be irritable for the next few weeks. C, actually I'm gonna skip to E because like joint stiffness is going to happen with Kawasaki disease. But for the third one, it's either B or C on my end.
Okay, so B and C. Anybody else? Okay.
Yeah.
So it's A, C, and D. So they are going to be irritable, so that is expected. So when we are telling the parents education on Kawasaki, they're still going to be irritable. C, they can't receive any live vaccinations for 18 months. And then D, they will have joint stiffness at the end of the day. Okay, fevers, peeling of the hands and feet is expected. And they shouldn't have to provide this to the provider. And then joint stiffness is worse during cold weather. So A, C, and D. So this is what we're teaching the parents about Kawasaki. All right, let me see another question. Okay, we have a 8-year-old going to cardiac surgery. Which of the following actions should the nurse take? Provide education immediately before surgery, plan a teaching session, use the doll, or discuss methods to cover the scar once the healing has occurred.
B.
What do you guys think? B? Answer is C. Use a doll.
Dolls are really good to help demonstrate any like type of disease for kids.
Okay. Let's go to another week and do those.
Yeah.
think you guys are starting to fade out. Are you guys tired? I know you guys are tired.
Well, yeah, we've gone 2 hours and 15 minutes straight. So
Do you guys want a break?
I think Anna suggested a 10.
I don't see.
In the chat.
Yeah, I think that was for the Kawasaki, the fever or something.
Oh, really?
I don't see any reason.
Okay, so let's take a 10-minute break.
Yeah.
Come back at 2:25. And then we can continue. If you guys, we can continue as long as you guys want. I just want to know you after a while you guys tune out.
Yeah.
So let's take a break.
Okay.
2:25, and then we'll resume right in 10 minutes. Okay?
Yeah. And then right click which one are you going to add it? Oh, combine them first, or you can just add a file. Move it over. But it may, yeah, add files, yeah, and grab it, and it may ask you where you want it. So you want it after this. Well, you have to figure out where you want to add it. CSLB complete that statement is going to be pretty far down in the depth, you know.
Are we just quiet? I think we're just being quiet.
So the DA complaint goes first. Then my document.
I wouldn't show your document should go first.
I'll go second.
Go second, but your document has to go second after the declaration, which is in the CSLB.
I took that out of the CSL
Oh, you did?
and then I modified it.
Oh, you want? Oh, okay.
To
So
make it make sense.
all one document.
Yes.
Oh, okay. So you just put it to where it was all redone all in one document.
No, the CSLB complaint is still in here, but the declaration within the CSLB complaint, I took that and copied and pasted it into Word, and then I changed.
So it's all in one. Oh, okay. Okay, so then yeah, put that. You just want that foremost after your, yeah. I thought they were still separate.
No, because it tells the story.
Right. Exactly.
And that's what they're gonna need. But do I need to put I feel like I need to put a header on it, like
just insert a blank document. Right click, insert blank document, and you can put in a text being like, this is the statement of events. So when you get your documents combined, go to organized pages. You're gonna have a whole bunch. Go to the spot where you want to add it. Get your cursor, right click, insert blank document, double click on the document, add text. Wait a minute. A lot.
Oh, I know. I'm just going through it now because I have a document that is all one piece.
Oh, it's probably close to 100 pages.
Okay, I think are we done?